There are many definitions of survivorship, but here we use the term survivorship at diagnosis. If you're living with a cancer diagnosis, then you're a survivor. So we have a survivorship clinic. When patients finish their treatment, between any treatment, it could be surgery, chemo, radiation, or any combination. We like to see patients within 3 to 6 months of completion of treatment. And we have a survivorship clinic that the patient visits last about an hour. And our physical medicine rehab physician, Dr. Nelson, sees our patients and can address any issues the patient's having left over from treatment. Like fatigue is one of the most common problems, but fatigue, cognitive issues like forgetfulness, things like lymphedema from lymph node removal or biopsies, just basic deconditioning. Patients seem to be more sedentary during treatment, so that goes along with some muscle atrophy and just decreased endurance. Some patients want to be able to work back up to where they were before treatment. And then we also have available to our patients the dietitian. She can answer the patient's questions as specifically related to their diagnosis. And also, if needed, we have a social worker, sexual health therapist, and also a chaplain if patients are dealing with any emotional distress or mental distress or any spiritual distress. We have those available. When our patients leave, they're pleasantly surprised at all the resources that we can offer and issues that may come up that they may have not even really recognized themselves, but just have accepted as, well, this is my new way of life now. It's good for the patient to know exactly the things that we can address, even if they're not having trouble at the time at completion of treatment, because things can come up later, 6 months to a year later, or even later than that. And I think one thing that patients really appreciate is I become their contact. They're used to seeing their infusion nurse every week or their radiation nurse every week, and they have that rapport with them, and they can, if they have questions, they can ask them. After treatment's over, they no longer have that day-to-day contact with their nurse. So that's kind of where I step in. They have my contact number, and I tell them that they can call me at this point if they have any questions or start to develop any problems. Then I can get them into the service that they need.